So diabetes is a chronic metabolic disorder and it's characterised by elevated blood glucose levels. And this is due to insufficient insulin production or an impairment in insulin utilisation. So insulin is synthesised in the B cells in the islets of Langerhans, which is within the pancreas. It's then secreted into the portal blood system. Now, after it crosses the liver, it then enters the systemic blood circulatory system. So insulin has various roles in the body, and some of these include anabolic actions on ingested carbohydrates, proteins and lipids. Its main role, however, is to enhance the uptake of blood glucose by the tissues, particularly the liver and the muscles. The secretion of insulin is stimulated by rises in blood glucose levels, and it's suppressed by low blood glucose levels. So, ensuring that the blood glucose levels are tightly controlled, insulin does this, and irrespective of those high fluctuations during meal times. So if the blood glucose levels rise significantly, then you get glycosuria, because the renal glomerular filtrate exceeds the capacity of the proximal tubules to be able to reabsorb it. Now, diabetes can have profound implications for oral health, and it's really important that you understand the underlying pathology of diabetes, as I've just discussed, the treatment modalities that are employed, and the acute and chronic management of the disease is absolutely paramount for us to be able to understand and therefore provide comprehensive, safe, effective care to our patients. So as I've mentioned, the underlying pathology is primarily categorised into two types. So type 1, where the body fails to produce insulin, so no insulin at all, and type 2, characterised by insulin resistance. Now, type 1 diabetes often starts at an early age, prepubescent, and it's got genetic links with HLA D3 and D4, and it's due to an autoimmune beta cell destruction. So the symptoms include polydipsia, polyuria, loss in weight and ketosis. However, type 2 is usually diagnosed and comes about in older patients. There's no HLA association and it's due to insulin resistance or beta cell dysfunction. And it often can be asymptomatic until an acute systemic presentation, which may be something related like a cardiac event. However, in both cases of diabetes type 1, type 2, prolonged elevated blood glucose levels contribute to systemic complications. Type 1s are usually better controlled, so microvascular and macrovascular complications are common, and these affect the small blood vessels and the large arteries respectively. So patients with diabetes are at an increased risk of cardiovascular disease, neuropathy and compromised immune function. So it's important to bear these things all in mind with your patients. So management of diabetes involves initially lifestyle modification, particularly type 2s, oral medications, insulin therapy, or a combination of these approaches. Now, you should be aware that oral health is intricately related to diabetes, and we've got to be aware of the potential impacts of various treatment modalities on oral health. So some of the oral medications, such as the anti-hyperglycemic agents, they can sometimes cause dry mouth, so xerostomia, and that therefore, if not managed appropriately, will increase the risk of dental caries and oral infections. Now, additionally, those individuals taking insulin therapy, they may experience fluctuations in blood glucose levels, and this often necessitates careful consideration during dental procedure treatment to try and prevent any hypoglycemic events. So the effects that diabetes can have on oral health, it can contribute to an increased susceptibility to periodontal disease. If diabetics are poorly controlled, then it can impair their immune function and delayed wound healing. So thinking about surgical management, patients might be more at risk of non-healing surgical sites, exacerbating periodontal issues. Things like gingivitis and periodontitis are more prevalent in diabetic patients. And that's why it's really important that oral hygiene management is meticulous and regular checkups are arranged. So diabetes can also lead to an altered taste perception and a higher incidence of fungal infections like candidiasis. So it's really important that we're vigilant with our oral assessments in these patients and that we educate them appropriately. So the HbA1c or hemoglobin A1c is a blood test which provides information about a person's average blood glucose over the past 2 to 3 months. So it's retrospective, and it measures the percentage of hemoglobin that is glycosylated or has glucose attached to it. And this is a test that's commonly used to assess patients' diabetic long-term glycemic control. So they should have an awareness of what their HbA1c is. So a HbA1c level of less than 6.5, or it is generally considered good glycemic control. And this indicates that the average blood glucose levels over the past few months have been within the target range. However, a HbA1c level between 6.5% and 8% suggests that their glycemic control is fair, and it indicates that the blood sugar levels have been elevated but may still be manageable within adjustments to their treatments. Now, an HbA1c level above 8% indicates poor glycemic control, and these are the patients that we're particularly concerned about. And this would suggest that they've got constantly elevated blood glucose levels. Now, this may increase the risk of diabetes-related complications, some of which I've already talked about. So the HbA1c results are used by healthcare providers to adjust the treatment for these patients, and it gives them an idea of the control of the diabetes over time, particularly retrospectively. The medication dosages, the lifestyle changes and other interventions may be modified to achieve better glycemic control when they've reflected on the HbA1c. We know that higher HbA1c levels are associated with an increased risk of diabetes-related complications, such as those I've mentioned, but particularly cardiovascular disease, renal disease, and peripheral neuropathies. So lowering the patient's HbA1c levels can reduce these risks, and it's really important that patients are educated with regards to this. Now, the HbA1c levels should be interpreted in the context of the individual's overall health, their age, and any other medical conditions that the patient has. And personalised treatment goals may vary between individuals, and their healthcare providers, their clinical nurse specialists, will consider all these factors when determining the appropriate target for each person and the management that they provide. So your patients may or may not know their recent levels, and it's certainly worth asking them to get an idea of what their control is like. And this will then obviously influence the way you manage your patient. So during dental treatment, attention to acute management in diabetes is crucial, particularly things like infections. These should be managed aggressively. Stress, anxiety and the pain associated with dental treatments can potentially influence blood glucose levels as well. So be aware of that. And you should really liaise and collaborate with the patients and their healthcare providers, their clinical nurse specialists, their GP, their specialist physicians, to establish a pre-treatment plan. Now, in the acute phase, monitoring blood glucose levels before and after procedures, ensuring patients have consumed their regular meals, and having readily available source of glucose if required in the acute situation is absolutely critical. But for the majority of these patients, we probably don't take their BM, their blood sugars, before treatment unless we're concerned. But having an idea of their overall stability is really important. Chronic management and long-term implications. The long-term oral health management for diabetes involves multidisciplinary management, so it's important that you do discuss with their healthcare providers and liaise with them, particularly if there are issues and you feel that the diabetic control is impacting on their oral health. But patient education is absolutely critical as well. Regular checkups, and as I've mentioned before, aggressive management of infections, and if there are any issues, then do by all means speak to their physician to discuss this. So overall, promoting oral health and glycemic control is fundamental in preventing diabetes-related complications, including those that will affect the oral cavity and implications for dental care. So in summary, we must be vigilant, we must be well versed in the intricacies of diabetes and how these patients are managed to optimise their oral health and their overall care, and have an understanding of the pathology and the underlying pathology of the disease, and how the different treatment modalities may affect us, and how we're going to implement appropriate acute and chronic management of these patients.